Aloha, everyone, and thank you for joining us this afternoon. My name is Leslie Gabrielle Harvey of the Hawaii Business Consultancy and board president of the Hawaii Economic Association. Nearly 1 year into a global pandemic, and businesses, small and large, continue to be adversely impacted. For too many small businesses, the result has been devastating. Today, we are pleased to have Professor Robert Fairlie discuss the initial point of impact on small businesses in April of last year. Professor Philip Garboden will also join us to give us a comparison of the impact on Hawaii small businesses. We'll close with a Q&A session moderated by Professor Lester Lesher. Next month, be sure to join us for what will likely be a very popular event. Lieutenant Governor Josh Green, UHERO Director Carl Bonham will discuss COVID-19 vaccination progress and rollout, health impacts and economic impacts for the state. This event will be moderated by UH Public Policy Center Director Colin Moore. Before we begin, a special thank you to our HEA members and attendees who continue to support our organization by joining us for our First Thursday events and for supporting our mission through membership. As we continue navigating this virtual space in the face of COVID-19, it's likely that additional adjustments will become necessary. For example, we are exploring alternatives to Eventbrite as it seems our needs have surpassed the capabilities of the platform. We hope that you'll continue to join us each month as we bring economic education to Hawaii. This month, we instituted a new structure, whereas Q&A is reserved for Hawaii Economic Association members. Each month, we get more questions than we have time to answer. While we do our best, restricting Q&A to members will hopefully allow us to get through more of the questions. If you are a 2021 member, please submit your questions via the Q&A. If you're not, we ask that you refrain. Membership status will be verified and all other questions will be deleted. Feel free to comment and upvote questions at any time. Lester will solicit questions as time permits, prioritizing questions with a significant number of upvotes. If you're interested in HEA membership and access to Q&A, be on the lookout for the post-event materials, which will include more information. We've also enabled one at the beginning, which you saw. As you know, your submissions are anonymous. The window pops up and we ask that you take a few seconds to respond. At the end of today's webinar, I ask that you take a few moments to let us know how we did. Before you leave, check the chat function for a link to our feedback form. All registrants will receive the link via email as well. You'll also receive the slides and the recording very soon. And before we jump into it here, I wanted to also mention our Facebook presence. We've been more active as of late and would love to connect with you there. We share articles and information of interest as well as our event announcements. Please find us on Facebook at Hawaii Economic Association. Okay, now to begin. First, I'd like to introduce Lester Lesher, who joined the Department of Economics and Public Policy Center at the University of Hawaii at Manoa in 2017. Lester's research centers around a broad array of topics in education and public policy, including monetary incentives, commitment devices, teaching assistance, sleep cycles, and unemployment insurance. His work has received support from several notable foundations and has been featured in several media outlets, including Hawaii Public Radio and the Washington Post. He earned his PhD in economics in June 2017 from the University of California, Davis. He also holds a master's degree and a bachelor's degree in economics and a bachelor's degree in statistics from the University of California, Davis. Lester, I'll turn it over to you.
All right, thank you so much for the introduction, Leslie. So it's my honor now to introduce our two speakers today. First, Robert Fairlie is a professor of economics at the University of California, Santa Cruz, and a member of the National Bureau of Economic Research. His research interests include entrepreneurship, education, inequality, information technology, labor economics, and immigration. Recent research projects explore questions around what causes racial inequality, the barriers to business creation and growth, whether technology helps students, and whether there have been disproportionate impacts of COVID-19 on small business owners by race and gender, and water conservation policy. He received his PhD and MA from Northwestern University and his BA with honors from Stanford University. He has held visiting positions at Stanford University, Yale University, UC Berkeley, and Australian National University. He has received funding for his research from numerous government agencies and foundations. He is regularly contacted by the media and has testified to the US Senate, US House of Representatives, US Department of Treasury, and the California State Assembly regarding the findings from his research, and received a joint resolution from the California legislature. Actually, I think just this morning, he also testified at the US House of Representatives. Anyways, our second speaker today will be Philip Garbodin. Phil is the endowed HCRC professor in affordable housing economics, policy, and planning at the University of Hawaii at Manoa, serving in the Department of Urban and Regional Planning and the UH Economic Research Organization, UHERO. Broadly construed, his work considers how supply-side actors such as landlords and real estate developers respond to housing policy. And with that, I believe I hand it over to Robert Fairlie.
Thank you. Just get set up here. Okay, so hopefully you can see the slides and they're not advancing.
They were shared there. Oh, there we go.
No, it should work. Okay, so that advances, right?
Yep.
Okay, so I'm here to talk about the early stage impacts of COVID on small business owners in the US. So I first want to thank everyone for inviting me. It's great. I wish that I could be out in Hawaii. Although where I am in Santa Cruz is also very nice right now. It's probably a little bit cooler than where you are, but I always enjoy coming out to Hawaii. So it's too bad we can't do this in person. But I'm going to talk about something that's really at the forefront of a lot of discussions right now, with the economic impacts of COVID-19. So if you think back to the early stages of the pandemic, stores, factories, many other businesses were basically closed down, partly because of policy mandates, but it was also because of downward demand shifts. A lot of consumers were nervous. They didn't know what was going to happen, so they avoided stores that were even open. Even takeout restaurants and things like that because of health concerns. And there were other factors involved. So the early effects of COVID-19 were actually really hard to measure, back in, say, April, May, because there really just isn't timely data on entrepreneurs. It's kind of surprising, but the federal government doesn't release up-to-date information. Typically, their information on small businesses or startups is released a year or even 2 years later. And so I got involved in a project where I was trying to get access as early as possible to data on small businesses. And what I wanted to use federal government data from a nationally representative sample. So what I did is I turned to the Bureau of Labor Statistics, and they collect data that measures the unemployment rate, or one of the two measures of the unemployment rate, the household-based survey. And so I was able to get that data with only about a month and a half lag. And so what I looked at was, I wanted to know how large were the early stage impacts of COVID-19 on small business owners. And I was particularly interested in whether or not there were disproportionate effects on female, minority, and immigrant business owners. So that's what I'm going to show you as results from that. So going back in time, March 11th was when the World Health Organization declared COVID-19 a pandemic. March 16th, in the San Francisco Bay Area, it was Santa Clara County imposed the first shelter-in-place restrictions in the country. And March 19th, so just 3 days later, the entire state of California said, we're going to impose these shelter-in-place restrictions and really limit the spread of this disease. New York State followed the next day on March 20th. And then by early April, most states in the country imposed some kind of social distancing restrictions. So that's the timeline. So let's look at what happened then to business owners. What I'm measuring is whether or not a business owner is active. It does not tell us anything about their sales level or how active they are. It's just whether or not that business owner is currently operating their business. Now, if you look over time, it's relatively steady, and there are about 15 million business owners in the US. And these are business owners of all types. So they could own firms with employees, with no employees. They could be incorporated businesses or unincorporated businesses. But the key feature here is that this is their main job activity. So this would not include an Uber driver who works, a full-time or even part-time job in the wage and salary sector. So these are, it's one definition at least of business ownership that's widely used. So you can see over time that it doesn't really change that much. There's certainly some seasonality and some other factors that are going on. You can see kind of a dip in the Great Recession, around 2008, 2009. And then all of a sudden, April 2020 hits. That 1 month period, we typically measure it from February because March, there's sort of a partial effect. You can see this dramatic drop in the number of business owners in the US. It was actually a 22% drop from February to April, and we lost 3.3 million business owners in that 2 month period. Now, I was really interested in the demographic effects to see if there were disproportionate effects. And so I looked at this by a number of different characteristics that were available in the data that I was using. So first of all, female business owners were disproportionately impacted. So there was a 25% drop from February to April among female business owners compared to a 20% drop in male business owners. Part of this was driven by the industries that female business owners are in. So they're more likely to be in personal services and other ones. And I'll come back to that in a second. The number that was the most striking, though, and got an enormous amount of attention in the policy world is this 41% number. So 41% of African-American business owners stopped running their business in April, compared to February. So it was a massive change. I've done a lot of different analyses to try to figure out if this is a break from trend or, kind of more complicated seasonal adjustments and things like that. And it's pretty much a similar number. We're seeing this huge drop that happened in April. Latinx business owners also saw a very large drop, 32%, and also Asian American businesses dropped 26%. When we look at this for immigrants as an entire group, immigrant business owners saw a huge drop of 36%. Compared to US born, you see an 18% drop. So clearly among these different demographic groups, there were disproportionate effects in April. And so one of the things I was interested in is trying to figure out why. Was this something about race, or was it something about the industries, the types of businesses they were in? So I looked at this across industries among business owners, and there are not a lot of huge surprises here. Personal and laundry services dropped 80% from February to April. So that's expected, right? Those are real in-person type services where there's a lot of person-to-person contact. A lot of the mandates had shut those down, or even when they didn't, if it was an individual, say, hiring someone to help them out, consumers were nervous, right? So it wasn't just the policy mandates, but also consumers were very nervous about maybe having someone come in their house to clean it or do any other kind of work like that. Then on the flip side, you look at agriculture, and agriculture was considered an essential business, and you see a slight increase in the number of business owners that were in the agricultural sector. Then other kind of mainstream ones like construction, we saw a 27% drop. So a lot of bigger projects continued in the shutdowns, but a lot of small projects. You can imagine if someone was remodeling their kitchen, they probably became very nervous and kind of decided to wait at least for a few months to see what was going to happen. And then professional business services, that was kind of on the, right around where the mid-level was. And those were high skilled business owners. Like you think of dentists' offices were often closed at this point in time. Of course, doctors' offices were not. So there's a little bit of mixing those two different groups. So then when I looked at different groups to see what percent it explains or does it contribute, I certainly found that. So female business owners, part of the reason that they had a disproportionately high level of shutting down was because of the industries they were in. And of course, personal services was one of them. Similar for Black-owned businesses, Latinx and Asian businesses, that all of those the industry distribution contributed to why they were more likely to shut down. One of the factors that's not shown here, but I am pretty confident had a big effect here, is the scale of the business. So a lot of minority-owned businesses, female-owned businesses, immigrant-owned businesses are smaller scale in general. And so a lot of other data sets show that, and it's pretty consistent evidence. Those types of businesses were more likely to be shut down. You can imagine if you owned a franchise of, say, Burger King, that business probably never shut down. They switched to their drive-through. They had corporate headquarters telling them how to deal with the regulations, how to continue operating in a safe way. Whereas if you owned a local resident in a downtown area, and especially if it was owned by an immigrant or by a specific ethnic group, that business is much more likely to have shut down, right? It was smaller scale. It didn't have the resources to deal with it. It certainly didn't have corporate headquarters telling them what to do. So the numbers that I showed you, especially for African Americans, had created a lot of attention in the policy world. So here was one of the kind of the most noteworthy examples. So Kamala Harris is quoting the number 40%, although she gets it slightly wrong. It was 41%, but she's talking about 40% of Black small businesses that were closed during COVID. And this was legislation to invest more in minority-owned businesses. It specifically targeted the Minority Business Development Agency and created regional offices that had more power to really go out and help minority-owned businesses during this time. There was just a lot of lack of awareness of what was going on. And so the timing of my release of a couple of papers back in May and June really contributed to their understanding and contributed to their concern about what was happening, and that we really needed to do something to help minority-owned businesses. And so it was nice to see that it made a difference and that it was brought into legislation. I'm also doing some research on minority unemployment. There we found huge effects, right? So all groups pretty much saw a big increase in unemployment from February to April, but we certainly saw bigger jumps for African Americans and Latinx and Asian Americans. Some of the trends that we saw for Blacks and Latinx were quite alarming, right? We saw unemployment rates in April that were around 17 and 18%. Fortunately, those were the peak levels, and that it returned not to normal, like we're not even close to normal, but it certainly came down after that. But that was also another concern, is that unemployment was also very high. Now, has there been a rebound since April? So I decided after doing these early papers that I would continually track it. So pretty much every month or maybe every other month when the new data come out, I posted up on my webpage what's happening. And here's what was happening until October 2020. So the bottom point that you can see in the middle of the graph, that's April, right? The big drop. And you can see May, June, July, August, September, and October. Every month showed a consistent improvement in small business owner activity. If you look at it across groups, there are some differences here. So Black-owned businesses saw continual improvement, pretty much coming close to the level that they had pre-pandemic. Same for Latinx businesses. The one exception that we still don't fully understand the reasons for is Asian American businesses. Now, part of the concern there is, the types of businesses, personal services, especially ones with a lot of like person-to-person contact. There was also a lot of concern in the beginning that there was discrimination against Asian businesses, partly because the concern that, that the disease came out of Wuhan, China, that it would be, transferred to the US and that those businesses were more likely to carry it. What's happened since? This is what I think is extremely alarming, and I was talking about this morning in my testimony to the House of Representatives, is we saw this continual increase since April, right? All the way to October 2020, small business ownership activity increased. But in November and December, it decreased. Now, this could be partly because of the concerns over Thanksgiving, over the holidays, more mandates trying to slow the spread of the disease, trying to keep people home. Or it could be something worse, which is that these business owners have struggled and struggled and struggled and remained active at a much lower revenue level of activity, but finally have kind of given up and saying that they're now permanently closed. And that's something, of course, we're not going to know for sure for a few more months. If you look at it and you start to get, try different comparisons, these are the data month by month. So you can see at the bottom, I'm showing the November and December levels. And you can see that we're now down 6% from where we were in February 2020 in December. If we look at it from the previous year, from December of 2020, we're down 7%. If we do a regression adjustment where we control for seasonality and control for a trend, a pre-trend before the pandemic, then we're down 8%. So we're down anywhere between 6 and 8% off of where we should be. And of course, it'll be really interesting to see what the January numbers show. And they'll be out in about 3 or 4 weeks. Also looking at it across groups, what you see is pretty consistently, for African-American business owner activity, also, seems to have hit a peak, right, in October and has reversed since then. And one of the numbers I'm showing from the regression adjustment is that we're pretty far off trend. We're about 12% lower now. Same for Latinx. There was this optimal amount in October. I mean, optimal, but a peak amount in October of business activity, and it's reversed since then. And then you can see this really troubling and unknown, for the most part, effect for Asian Americans, where Asian American business owner activity is still down, and it hasn't, fully recovered at all. It's still, 20% off. I'm also doing a lot of new research, building on these earlier findings and my constant tracking of small business activity. And so I'm just going to briefly talk about a couple of those projects. The first is, I've been really interested in understanding government aid. So the PPP and the EIDL program. So the PPP is the Paycheck Protection Program, and the IDL is the Economic Injury Disaster Loan Program. Those were massive programs. We spent over $650 billion. I mean, these two programs combined are the biggest government expenditures we've ever had that have been targeted towards helping small businesses. And they've been in the form of loans. They've been in form of forgivable loans in the Paycheck Protection Program. Example, part of the EIDL program has advances, which are small amounts of money to try to save employees. Another part of the EIDL program is actually more focused on rent or utilities or other expenses, and not so much on saving employees. The PPP program was definitely targeted towards employees. And so I'll show you some estimates on that and what we're interested in there. And then more recently, I have a new project looking at sales losses. So I was able to get administrative data from the California Department of Tax and Fee Administration to start looking at what happened to sales. That actually is a very difficult measure to get. The Census Bureau tracks the sales of small businesses, but as I mentioned earlier in the talk, they typically only release those 1 or 2 years later. And so it's really hard to get up-to-date information on that. And so that's why I kind of turned to California data. So the Paycheck Protection Program, one of the big concerns with it is early on, it looked like it did not go to minority communities. And there's clear evidence that was the case. So if you look at the left-hand side, this was the first round of the PPP program. What had happened is that Congress had rushed the program out so quickly in response to concerns about small businesses closing, that they basically relied a lot on large banks to give out these loans. So by doing that, that made it so that the businesses that got access to it were not the smallest small businesses, but they were the larger small businesses or medium-sized businesses, because they are the ones that had established relationships with their banks, and especially bigger, more established banks. And so this was a huge problem. It was addressed in the media. It was, commented that this was a major, inequity. And so the second round that started in April 27 to August 8, what the federal government did is they went in the other direction, and they said, look, we've got to get fintech, financial tech institutions involved. We've got to get community banks, credit unions, local banks, much more involved in this and make sure that we get out more loans. And in some sense, they were successful. So you can see the positive relationship with the minority share of the population, which is on the x-axis here. And so there was a bit of a reversal, at least in the terms of the number of loans provided. In some of the other work we did, when you look at loan amounts, there still was this kind of disproportionate aid going to non-minority communities, which is troublesome. But the EIDL program definitely was much more targeted to disadvantaged areas, and that appears as though it was going out to minority communities. So that was a good sign in both loans and total number of loans. Okay, so now let's switch over to sales. So I was interested in trying to figure out what happened to sales over this period of time. So you can see just in the past, if you look year over year growth every quarter in total sales of all businesses in California, what you see is about 3 to 4% growth. Then all of a sudden we get into quarter one and you start to see a bit of a drop, but quarter two of 2020 was the real drop. So that's April, May, and June, right? So the 3 months at the very beginning of the massive shutdowns that we saw throughout California. And we saw this big drop of 17% in that period of time. What's kind of hidden here is that there were much bigger drops in certain industries. So one of the biggest drops was for accommodation, so hotels. Those hotels dropped by 91% in the second quarter of 2020 relative to the previous year. So that's just devastating. Restaurants also saw more than a 50% drop. Clothing stores was another one that was shut down, saw over a 50% drop. Bars, drinking establishments also saw huge losses. And so, this is a real concern for a lot of the small businesses that are in these industries. On the flip side, what we're finding is that online sales grew by 180% in the second quarter of 2020. So while all of these small businesses are struggling, in-person sales are dropping, here we have this boom in online sales. And so I think that that's one of the biggest concerns we have, is that if small businesses, which typically do not have an online presence, don't change and somehow get some more of an online presence, that could be a big problem, because I don't think consumers are going to fully switch back to in-person consumption. I think that this is kind of a more long-term effect that we're seeing. We also were really interested in seeing if sales were related to COVID cases per capita. So these are all the counties in California. There are 58 counties. And what we did is we just looked at the relationship between sales losses in quarter two of 2020, which is the latest data that are available, and the number of COVID cases. So these are COVID cases early in the pandemic, right? This is just the second quarter. So this is April, May, and June. So I think what we did is we took the midpoint. So we took May 15th as our cutoff date. So the idea is, if you saw a lot of early cases in some counties, like for Los Angeles, for example, or San Francisco, what happened? Like, did we see bigger sales losses in those? And you can see there is somewhat of a negative relationship here, that sales losses were bigger, more negative in the places with more COVID cases. But certainly we can't make any kind of strong causal argument about this relationship. We're just trying to look at kind of a general pattern. If you're interested in more information, the research papers that I've talked about, I've got a lot of them posted up on my webpage. I'm going to continue tracking small business ownership activity because a lot of policymakers are interested in these numbers, and the press and researchers. So I also have that on my webpage. The Senate bill that I talked about, here's the link to it if you're interested in finding out more about what was involved in it. And then the House testimony that I did this morning actually also is here. I have the written testimony if you're interested. It kind of summarizes a lot of the things that I just talked about today, and also provides a few prescriptions on what we can do for the House. So thank you very much. I'm curious about questions and question and answer period later.
Thank you so much, Rob. That was great. Really enjoyed it. So next we'll move on to Phil, I believe, and then we'll move on to our Q&A section.
Terrific, terrific. Yeah, thank you very much for that. Presentation was fascinating. So I hope to talk briefly here to sort of talk a little bit about the local context and what we've been seeing, and specifically a small business survey that we did in July of 2020. And in the spirit of the previous presentation, I'm going to sort of highlight places where we can identify disparities, both in terms of business owner, but then also type of worker that that was affected by the situation here. So a little bit about the survey. I won't go into too many methods here, but it was a partnership with the Chamber of Commerce. Most of the respondents were from their membership lists across the state. We did some earned media as well, but primarily as members of the Chamber of Commerce. It was collected in late July 2020. We got a robust response rate in total, but they're just as usual, we're going to have large margins of error for any of the smaller sectors. And in some cases, we actually redacted sectors of the economy where we only got a couple of responses because we didn't think it was responsible to put numbers out there with such large MOEs. So our survey did not include the largest employers. I think that's useful in the context of this particular seminar. So hospital systems, University of Hawaii, things like that. We didn't take the time to fill out our survey. And I think we also underrepresent the smallest businesses. We had a lot of small business, but the sole proprietorships, the folks who maybe were even informal small business people were less likely to fill out our survey based on what we know about the distribution of business ownership across the state. And we weighted the data to reflect the statewide distribution of jobs whenever we're talking about job numbers, and businesses whenever we're talking about business numbers. So if you want more of this, if you want more tables, you're going to see quite a few tables, but if you want more tables, you can go to uhero.hawaii.edu. All of this is up there. You can just search for my name in the search box and scroll past all of the housing work that is most of what I do. And so we don't have, the survey was done in July. We don't have data updating that survey after that period. DBED did a survey in September that a few months later, and as far as I know, there hasn't been a similar one done recently, although I could have missed it. But the overall pattern here in Hawaii, this is the economic pulse that Peter Falecki and Carl Bonham from UHERO put together, is that despite some of the more optimistic upward trends that we saw in the previous presentation here in the state, up until at least the end of the year, we were still low, much lower than baseline on sort of general economic activity as a whole, right? And I was sort of intrigued by this idea that some of the businesses might have started up again, but at much less, revenue capacity. So unfortunately, our economy, at least in December, looked not that dissimilar than the economy at the end of July for Hawaii. So we are in it, as they say. All right, so the first thing I wanted to talk about, and I don't think this will be a surprise to any of the listeners, is the sectors where we saw both the worst and the sort of, and the not the worst, I won't say best, changes in employment. So this is a table that just lists the sectors in our economy, the percent of revenue that those sectors, or at least the respondents in our survey from those sectors, get from tourism, and the percent change in employment from January to April, and then the percent change from April to July. Right? So the big change is for all of these, but not entirely all of these, is the change from January to April, where we saw the big drop, and then some recovered slightly and some continued to decline. So I wanted to highlight these three as particularly salient. These are large sectors of our economy. Accommodations, obviously, hotels saw 88% drop in employment during the depth of the shutdown, and basically flat from April to July. Food services saw an enormous drop as well, and retail trade. So the things you would expect, your brick and mortar types of industries saw the big drops. Some of the more resistant or resilient sectors are construction. We saw a small drop, again, probably because of the single family, sort of people pulling back on making renovations there on security, but any of the large construction projects continued on. Finance and insurance, wholesale, things like that were less affected overall from these downturns. And I think before I move ahead there, this is important because when we think about business ownership and female-owned businesses, minority-owned businesses, those are not the same across all these sectors. And so who operates within these sectors is meaningful in terms of the eventual disparities of the downturn. This is a very muddy slide, so I'll just switch to the one that focuses on what matters here. We also saw vast disparities across the various counties. The Oahu did quite poorly. This is the percent of revenue declines reported by respondents in our survey. So in Oahu here, in the lower left-hand area, 10% of respondents said a 10% decline in job, 7% said 70-90, and 12% said down 90 to 100%. So basically not operating anymore. If you look at Maui and Kauai, which are right now covered up by the smiling faces of my co-panelists, if you look at Maui and Kauai, it's not hard to see that these numbers are dramatically worse on the neighbor islands. Again, this is a function of the dependency of those neighbor island economies, specifically Maui and Kauai, on tourism, large resorts being the primary employers, large resorts that were primarily shut down during the period of our survey. The Maui numbers for this particular survey were quite dramatic, alarming, and I think, on every indicator, they've continued to suffer disproportionately compared to the rest of the state, as well as Kauai. We did collect data on the gender of the business owner. We did collect, I should mention, we asked about minority-owned businesses and Hawaiian-owned businesses. The minority-owned businesses, given the context here of race and ethnicity, are fairly hard to interpret, so we couldn't say anything inclusive about that. And unfortunately, the Native Hawaiian Chamber of Commerce was running a similar survey at the same time, so our power in the Native Hawaiian business owners was too small to have reliable results. So mostly what I can talk about in terms of business owner here is gender, and very much in line with what we just heard. Our women-owned businesses reported substantially more pessimism about their business's future. You can see this was back in the days when we weren't sure if and when tourism was going to reopen. I guess we still kind of aren't sure, but we gave them two scenarios: one that would open in August and one that would open in October. And so the column in the middle is more optimistic because it's contingent on the tourism opening well earlier than it did, and then the one on the far right is the one October. And then you can feel free to debate whether or not you consider tourism open or not at the moment, but certainly better than it was in July with the Safe Travels program. So the point of this is a subjective measure. All of the tables from people reporting revenue, hiring, show the same pattern, as that women-owned businesses are substantially more harmed by the downturn than male-owned businesses, man-owned businesses. And I think that's primarily a function of the sectors in which those businesses work, right? When you're looking at tourism-related employment, food service, et cetera, those tend to be more likely to be women-owned in our data, and therefore that sort of shows a disproportionate effect on women-owned business in a meaningful way. We're also able to talk about worker disparities here. I'm going to be talking some from our survey, also some from some UI analysis that we did around the same time of the unemployment insurance program. Oops. Sorry, I thought there was going to be a red box that appeared there. So you can see that the middle column is the percent change in that category between January and April 2020, so the first downturn, and then the change in April to July for the second downturn for businesses. You can see, again, most of the reduction was done in that former time period. Interestingly enough, the folks making less than $30,000 a year, who I assume are sort of part-time temporary workers, were in some ways easier to keep on early on, and then as the downturn extended, they were the ones who were sort of laid off a little bit later. They were cheaper, presumably, more able, and it was the sort of middle incomes, which in Hawaii terms are not all that robust, that suffered the initial losses, and then stayed losses, and then higher income brackets, folks earning over 100,000. Saw fewer reductions, as I think is confirmed with national statistics and everything as well. There's a much less of an age story here in Hawaii than I think I've heard in news reports from the nation. The blue bars are the share of the workforce. The orange bars are the share of the UI claims, right? And it's largely, you know, there's little jumps up and down here and there. Being under 22 meant you're much less likely to be a UI claim, but that could be a function of reporting those types of jobs and UI eligibility and so forth. By and large, I think the pattern of the workforce and the share of claims largely mirrors each other throughout the distribution. This is not the case of gender. So women make up about half of our workforce here in Hawaii, but we're in July, 57% of claims. So the fact that this downturn is affecting not only women-owned businesses, but also women employees, again, speaks to the types of businesses, the types of jobs that were shut down during that period. And unfortunately, and this time it's not our fault, the UI reports, the majority of people are not reported in race and ethnicity. So they did not provide useful data for that, for this time period, at least on that question. All right, that's the lightning tour here. You can visit uhero.hawaii.edu to read more about any of these surveys or to learn about housing and whatnot as well, and anything else related to the state's economy. So I'll leave it there and look forward to Q&A.
All right, thank you so much, Phil. And again, thank you, Rob. One thing that I really enjoyed about both of those talks was after Phil was presenting, I thought, okay, it's great to see these numbers, obviously, for our own backyard. As Rob was presenting numbers, I was thinking, wow, these are the numbers that are influencing some of our national decisions. So it's really cool to hear it and see it sort of straight from the source. Okay, so let me open up the Q&A here and see what types of questions we have. Okay, I was looking at a couple of these earlier. So I'm gonna look at this first one here from John. So I believe this one's for Rob. Were you able to analyze the extent to which these gender or racial differences were mediated by business experience? So for example, how long the business has been in operation? To what extent can that be explained? Can these gaps be explained by experience?
Yeah, we can't actually look at that directly with the data. I think, kind of indirect evidence is definitely the case with the PPP program. So it was those businesses that had more experience, that had run for longer, that had more of a bank, established bank relationship. They were the ones that got the funding first. And, part of that was because the Congress had pushed out this program so quickly that they really relied heavily on the banks to kind of help them out in the beginning. But what it did is it ended up hurting, right? It ended up creating more inequality among kind of the early stage survival of businesses. Now, of course, as I mentioned in my talk, Congress came back and tried to create, kind of a more inclusive setup for getting financial institutions involved to go out and reach out to these other small businesses. But I think it's a good question. Like, we don't know that much. There's not a lot of good information on the experience of the business owner. It's not something that's typically collected on surveys. And it's unfortunate that it's not.
Great, thank you. Actually, one of the thoughts I had during your talk was you presented it almost as two separate things, where you see this trend in March, April of the drop in of activity of small business owners, and then the racial disparity in that as well. And then how the April PPE program obviously went more toward perhaps the more experienced businesses, and that how that might have exacerbated it. But actually, it still looked like the racial gap improved, if you will, of small business activity in the first graph in April and May. Is that a correct interpretation, or am I off here?
The racial gap in terms of the PPP funds, or in terms of?
No, in terms of, well, so I mean, based on the PPP results, it says that the racial gap should have worsened, right, of the small business owners. But do you also see that basically in that first part of the study that you show, where did it also worsen in April, May, or did I thought it started improving once May came around? Does the timing line up, or is it even able to identify it?
Yeah, so for all groups kind of showed improvement in May and June. But there was such a big impact, especially for Black business owners, that didn't recover nearly as fast, right? So May and June, those levels were still, more than 20% down from where they should have been. And then the other one is the kind of the puzzle that we still don't fully understand is Asian business owners have not recovered at all, right? I mean, they're still 20% down overall.
Right. And you posit that might be stigma or type of business. I mean, do you have any hunches or?
Well, certainly the type of business is an issue, right? You think of a lot of like personal services, like real small kind of mom and pop types of stores, right? Restaurants. There certainly has got this kind of stigma or discrimination still going on. But I also think it's scale of business. If the businesses are a lot smaller in total scale, then those are the ones that are harder to kind of reopen. Whereas, bigger businesses have been open. They've been open almost the entire time. And certainly franchises have also been very successful about keeping their businesses open. Now, for everything that I'm showing, and Phil raised a good point here, is that I'm looking at business activity of the owner. So is this work effort by the owner? And that's what I'm showing is down and then kind of came back up. I'm not looking at the sales of minority-owned businesses. The work that we did there, of course, is just administrative data that the state of California is giving us. They don't have race information on the owners. Like, we'd have to figure out some other way of trying to link those two. And so those are two different questions. And I think that business activity by a an owner working in that business is a very different thing than business activity measured as how much, what are total sales, what's the total employment, what's total profits. And so those are kind of questions that, we don't know yet, and we're going to have to get better data to look at it.
Okay, thank you. Okay, let me just go down the list here. So another question I think is related, probably also for Rob, but also related to that. I'm not sure you'll be able to answer this, maybe only speculate. It might be interesting to compare small business owner debt levels against the trends in the chart. So for example, surviving 10 months isn't the same thing as surviving 14 months. At some point, the debt overwhelms your efforts.
Yeah, that's a very good point. I think that would be one of the most interesting questions, and it's almost impossible to get that kind of data. I did a paper, several years ago where we were able to get that kind of information, but that data is now about 10 years old. And it was an incredibly expensive collection effort that was done by the Kauffman Foundation. It just, it's really hard to get like individual owner investment information, like how much they're putting into their business, how much they're adding each year, how much they put in its startup, how much, they're pulling from their own savings, how much they're getting from bank loans. I think all of those things would be really interesting to look at. And I hope that the Federal Reserve might be a good, agency to do this, is that they could come in and say, okay, we're going to do a really careful survey to see what happened. But otherwise, it's very difficult information to get. It's not something that the federal government, the Census Bureau, doesn't just collect investment data.
Thank you. Okay, next question. This is a many-part question here, and I think may be appropriate for both of our speakers. So they'd love to hear your thoughts regarding the different marginal benefits and costs that different groups have experienced in the past year. So I think that's what both of your talks were about. So for example, in Hawaii, Pacific Islanders represent an outsized share of COVID infections, and also probably greater hits to unemployment and household income as well. Do you think regulations like Oahu County's tier system provide marginal benefits in excess of costs? Or in other words, are the protections from the tier system more beneficial than the loss of income at the margin? So that's kind of the first main question. They also say, ask, does your assessment change if based on things like whether individuals' behavior will change regardless of the government regulation? Or using a more public choice framework that assumes that politicians and regulators are incentivized to act in some fashion regardless of what their actual impacts are. Any thoughts to that?
Phil,
No.
you should speak to Hawaii. I could speak a little bit to California, but not Hawaii.
I mean, I think it's good to discuss in general, maybe both of you, Hawaii, but I mean, in some ways, I think the California experience is similar, besides the fact that you're attached to the mainland, in terms of this discussion on quarantines, mandatory quarantines, and obviously the impact on the local economy, and whether this is a, what are the trade-offs, and what now that the vaccine's being developed and whatnot, what should we do moving forward? I mean, I don't know if anyone really knows the answer. You'll get many different opinions based on who you ask, but yeah, what do you guys think?
I can take a brief shot at a very complicated question, and I'll pass it to Robert for to say something more interesting. I think that obviously the logics here are changing a lot with the vaccine, and hopefully changing rapidly with the vaccine coming out. Up until that started happening, I think one important thing to recognize is that consumers, at least in the studies I've seen, start to shift behavior in advance of the public health mandates, right? They don't go to restaurants when there's all this health uncertainty. And when you see spikes happen in the community before the regulators respond, people start to shift in ways that are harmful to small businesses. And so in some ways, like a hard stop, but a short stop can be some ways more beneficial than sort of a long burn because consumers are not doing it. Now, in terms of the differential impacts and how you incorporate those ideas of equity into your models and into your cost benefit, that's an enormously important question, but not one I'm going to try to tackle right now at the moment. But it's an important insight. So.
I mean, I agree. Like, this is like the $100 million question, right? That people are going to do lots of research on, is sort of, those localities, those counties, or those states that shut down early, what was the benefit that they got in terms of reducing their number of COVID cases and the economic impact from that, versus the shutdowns in businesses and the lost jobs and unemployment that was generated by the early shutdowns. And I think, a great example was the testimony, the hearing that I was in this morning that lasted for almost 3 hours, going back and forth between, Congress members from, states that were much more open and other states that were less open, like, for example, New York and California, where we had shut down really early on. And so the representatives were arguing both sides, like, look, we opened up early and we were fine, we had fewer COVID cases. And what's interesting is they often don't see the huge differences in demographics, in the number of people living in each household, right, which spreads disease faster, the number of essential workers, which is another issue, spreading it to family members. And then, of course, just population density is another crucial factor here. So when you combine all of these different things, I mean, this is going to be one of the most complicated, important questions, I think, in the last 100 years, right, is trying to figure this out, is what worked, because who knows what's going to happen in the future, right? It's not like we're never going to face another pandemic, and maybe we can actually learn something from it. And maybe we can get things like under control a lot faster. And so that even though, maybe we have another contagious disease, but we can deal with it really quickly and not have such a massive economic shutdown as we did this time.
Right, I think evidence of a learning effect can be seen in Asia, right? Where obviously they dealt with, I'm generalizing maybe too broadly here, but other contagious infectious disease issues. And so, I think a lot of people point to the Asia experience as to why they reacted so much better and more quickly to the current pandemic.
People are pointing to Korea's, tracing. That was a key thing. Massive testing and massive tracing, like just checking where people were going and making sure it didn't spread quickly. They've also talked a lot about that's how Ebola got under control very quickly, right? Is that they, because it was so deadly, they had to like shut down villages instantly when they saw a new outbreak. Whereas with COVID, a lot of times young people would get it and not even know, right? And then they would spread it.
Yeah. Okay, thank you. Next question. I think this one's more for Phil. So lawmakers want to understand the visitor industry trickle-down effect percentage. So from this new data you're collecting, can you estimate, or do you have any sense of what the visitor industry economic trickle-down effect by percentage might be for our islands, or even for each island?
I think opening up the visitor, I don't know if this directly answers the question, but I think opening up the visitor industry has had, is as a fundamental aspect of our economy, opening up the business industry safely, as we appear to have done, knock on wood, is been, a positive impact. My understanding is that it hasn't, as I showed from that economic pulse data, it hasn't returned us to baseline, we're still suffering a lot of unemployment. The hotels that have come back, are operating below capacity, and so that's looks good on the job numbers, but from a business standpoint, there's still a lot of challenges there. I think things are getting better and overall getting better. And so, as the primary source of employment, both directly and indirectly throughout our state's economy here with tourism, I think that's had a major impact on, and is going to be necessary. And we've done, I won't wade into the political debates about how exactly we did that and when exactly we did that and all of those types of things. But as a fundamental aspect here for bringing back our economy towards baseline, it's been an essential element of that.
Great, thanks. This one's a quick question for Phil. So the survey, was it conducted through the end of December, or this was done?
No. So this was a July survey. Yes, I saw that question come up in the chat, and this was done basically to inform public policy efforts around closing and the PPP and all of those types of things. And so this isn't something that we have the resources to sort of continue as a regular basis, although Robert's thoughts certainly convinced me that it's something that would be very valuable to do as a panel.
Thanks. And then actually similar follow-up question. So the survey was done for participants in the chamber. Any idea how many businesses were impacted who are not members of the chamber?
So, the data I presented attempts to adjust for that by looking at, the people who filled out our survey and then the overall distribution of businesses, and tries to sort of do that distribution. Now, it's very likely that members of the chamber were overrepresented in our data, and members of the chamber may or may not have had a harder or softer landing with this, right? And the usual caveats around who fills out surveys and who doesn't fill out surveys and all those pieces. So, so I think, it isn't that our data, it's not that we think our data doesn't speak to people who aren't in the chamber. It's only that, the bias, there could be some biases there in terms of our recruitment. But I think the earned media helped as well in terms of rounding out some groups that didn't fill out.
Great, thanks. And then last question we have lined up. So if others still have questions, don't be shy. Lifetime above. I actually have some of my own, which I could also ask. But the last one we have on the list here so far. So Hawaii tourism has been open in quotation marks for 4 months. What are your thoughts on its impacts, if anything? I guess starting with how much has tourism returned, and then what are any sense of its impacts?
It's sort of what I said to the previous question. I think, it has returned in so far as the Safe Travels program has allowed people to come and visit under certain conditions. And I think, hotels are starting to see returns of bookings. One of the interesting things is that it seems like the booking window, we used to be able to predict 6 months out how much tourism we'd have in 6 months because people would plan their vacations to Hawaii. We're kind of far away. Now it seems like people are like, as soon as they're getting the vaccine, or as soon as they're sort of in a place where they feel it's safe to do so based on whatever their personal assessment of the public health situation is, they're booking like much shorter out. So it's a harder sort of forecast to make. But I think it's come back. It's not come back all the way. It's unclear whether it'll come back all the way for quite some time. Right? There's still going to be a lot of people who have less disposable revenue based on having gone through this over the last 2 years, but there also might be some pent up demand as well for vacations. So I leave it to other folks at UHERO to talk about the forecasting there.
I mean, one thing that I think about regarding this, and maybe it's just because I come from a niche group from California. I'm originally from California. A lot of my friends work in Silicon Valley, so maybe this is a niche question, but I have several friends who are moving here and working from home, and so that's been interesting to me. Like, how do we feel about this as people who live in Hawaii, and what economic impacts do this have? Is it positive? Is it negative? I mean, I remember there was I forgot what that one program was, but I remember there's a program that was proposed or is passing about trying to pay for people's flights to come here, but then getting them used to whatever Hawaii culture and whatnot. And then that a lot of people did not like that, did not receive it well. I think for good reason. But anyways, I wonder how much that's going to be big potentially, right?
Yeah.
Work from home arrangements are huge. I could see people coming here, but I don't know.
Yeah, and we're not, I mean, I actually just had a conversation about this, and we're not seeing that in any of our economic indicators yet. I think it's happening, right? I mean, it's clearly happening. Your friends are doing it, but it's not happening at like a scale that's moving the housing market or the economic market here. But it's certainly a possibility, and it speaks to this consistent problem we have here, where with our housing market and the cost of it, that we're losing people who can't afford it, and we're gaining people who can't afford it. And all people are wonderful, but I think from a political perspective, that sort of turnover in that direction is something that I think most folks here would be concerned about if we can't get under control. And as a housing person, to me, it comes down to a housing solution, right? Both the loss of population and then our inability to meet the demand of new people coming here and the impacts that would have. So.
I definitely I think that's the heart of the debate and the discussion, obviously, is the housing prices, the rental market, and so on.
We have a University of California DC office and program. We could have a University of California Hawaii.
Yeah, totally. Us UH Manoa might be in trouble. Okay, so we have another question from Douglas. Is there enough data from the surveys to make some predictions regarding the future in terms of small business closures in the next year or so? How confident do we feel about projections? Small business projections. I think that could go to either of you. Well, I guess probably more Rob.
Yeah. This is a shorter answer from me, which is not in our survey now.
Yeah, I don't believe any predictions that I've seen. I mean, I really don't think. I think that the range of an accurate prediction could be anywhere from like 20 to 50%. Like, we really don't know. If the vaccine comes out quickly and customers have all this kind of pent up demand where they really want to get back to downtown areas and shops and restaurants, then we could see kind of like a flood of spending going into these small businesses. And also, if there's just a lot of awareness that small businesses have struggled so much and that the only way they're going to come back is customers go back to them, that could really help, right? So there's things that could really, show up as a positive benefit here. The other thing is the rents have to go down, right? The expensive rents that we see in a lot of cities and areas of the US are going to have to drop a lot. And that could actually help small businesses lower their costs. And also there could be some more new entrants that come in. And that could be, a little bit of a shakeout, but at least there will be some new, there'll be some new firms that come in, new ideas, new businesses that show up. But on the other hand, let's say, it takes us a lot longer to get this vaccine out. We see, less financial aid to businesses than we thought was going to come. And it's slower, right? It all just happens more slowly. And we have this other worrisome trend to online purchasing that people are just much more used to it. They're more comfortable ordering packages and having them delivered to their houses. And they're just not as willing to go to stores. Then it's going to take longer. It's definitely going to take longer. We might see, more of like the 40 to 50% shutdowns. But it's really difficult to come up with a clear kind of economic or econometric model that's going to give us a good prediction, because there's just so much uncertainty and so much change happening right now that we're not even sure what to use as a trend. And that's the hardest part.
It seems to me, I mean, I think maybe this is an obvious statement, but I just want to say it out there, that probably the single most important input is the vaccine's efficacy in the long run and how quickly we roll it out, as opposed to, I don't know, government financial packages and whatnot. Those are obviously also important and help smooth consumption during these times. But to me, it seems like the vaccine is everything. Everything hinges on that. What do you think?
I agree fully. I think that's the number one. In the testimony I gave this morning, that was the first thing I said. But the number one, I exactly agree with you, Lester. The number one thing we need to do is get that vaccine out faster and more equitable. That's the other thing, is we're starting to see that. I just saw that, in the last few days in the news. And of course, poor, disadvantaged minority communities are not getting the vaccine as fast as other places. Well, those are the businesses that are struggling the most, right?
Makes sense. Okay, I'm going to ask call my own shot here, and then I'll come back to the Q&A list here. And I don't know if we'll have if either of you have a good answer for this. When we're talking about this gender difference as well. Women, men, business ownership. It reminded me of this question of, of parents, right? And they have to now homeschool their kids. They can't take them to school, and how I believe there's lots of discussions about how in a lot of these households, the onus is falling on the mother, not the father. Is there any interaction there, do you think? I mean, obviously there's no data on that, but do you think that's a big story or not as much, or I don't know, what are your thoughts on that?
We're starting to call it the motherhood penalty, right? And there's growing evidence, right? There are more and more papers that are being written about it, about how, mothers are taking more of the responsibility of rearing children, or not rearing children, but, watching children while they're in school, and that they're cutting their hours back from full-time to part-time, or even just stopping working for a while to kind of figure out what to do until schools reopen. And so there's a lot of concern that that's going to, create retrenchment, right? Women have made a lot of progress in the labor market relative to men. And so this could actually eliminate some of those gains that we've made in the past.
Yeah, agreed. Okay, actually, so the two questions we have less are more, they're less questions and more shout outs. So Paul Brubaker, look on YouTube for a video of the Travel and Tourism Research ASSN conference yesterday with a panel discussion on tourism economics with DBED's Dr. Tian and CBRE commercial real estate professional and himself, Dr. Brubaker. And then maybe Paul can share a link in the chat. Let's see, and then Pamela is following up on her earlier question about the visitor industry trickle-down effect. We used to say in Maui County that the visitor industry had a 75% trickle-down effect on our overall business and economic health. But given the devastation we've seen due to COVID and the impacts on ag, restaurant, retail activities, et cetera, we now feel that the percentage is considerably higher, possibly in the 85 to 95% range. We're looking to get a better handle on this percentage, which helps us as we discuss both the importance of the investment in shoring up the industry and investment in economic diversification efforts. Obviously, another hot topic, and I think we've had discussions on this in earlier HEA sessions, is diversifying our economy, right? So yet another important hot topic, given the ramifications of what we've experienced so far with COVID. Any other questions from our viewers? That's all I have lined up here. Let me knock these out. Is DLIR capturing that gender data and reduce hours, or leaving jobs to take care of children? Can we see that stuff?
I mean, they are. I think they are capturing gender. And so we would have to look at that from that angle to see what's possible. But yeah, I mean, I agree with what Robert said on that front. It's absolutely more and more evidence every day that that's a huge issue. And yeah, obviously is connected to another controversial topic around school openings and things like that we don't need to we don't need to engage in right now. But that regardless of the fact that there's been that huge impact on female workers and female small business owners, I can only imagine it is incredibly meaningful. But
thank you. Okay, so I think at this point we'll conclude the Q&A session, and then Leslie, I believe you have concluding remarks.
I do. Thank you, Lester. Thank you, everybody, for joining us today. We really appreciate you tuning into this very interesting discussion. It was nice to see the juxtaposition of Hawaii and the national data, so pertinent to our community here in Hawaii and our audience on the webinar today. Special thank you to Robert, Phil, and Lester for those fantastic presentations and that great discussion. We are welcoming a number of new board of directors this year, and we'll be looking forward to introducing them to you at March's event. So save the date, March 4th, for our next monthly webinar. Registration information will begin going out soon. And before people begin signing off, just a couple of quick notes. Members, this month we gave away 10 tickets for free. We're going to do that again next month, so be on the lookout for that promotion code. It will go out early when we begin marketing the event. Another note, we've had some issues case by case with access to the webinar Zoom link. As I said in the beginning, we are looking at other platforms that will give us a lot more usability and hopefully address some of these issues. But in the meantime, just know that our event emails come through MailChimp from our info@hawaiieeconomicassociation.com email address. So if you unsubscribe from MailChimp, you may inadvertently unsubscribe from all of our emails, which would include the Zoom link to our webinar. So just be careful of that, but we will be making some changes. The feedback form, attendees, please take some time to provide your thoughts on this event via the feedback form. You can find that link in the chat and here on the screen. It shouldn't take you more than 5 to 10 minutes to complete, and we really do look at these. We have a board directors meeting next week, at which time we'll talk about those responses. So please do give us your feedback. You'll also receive that link by email in addition to the slides and a recording of today's webinar. Just a reminder, we all are an all-volunteer board with a student intern, so please be patient. You should receive those materials next week. A special thank you to our HEA intern, Sierra Brewer, our VP of Programs, Reen Kamita, and Events Committee, and our VP of Marketing and Membership, Paul, for your work every month on our HEA events. And thank you to our attendees, those who are joining us for the first time and those who are returning. Thank you again for your time and attention today. And if you have any interest in joining HEA as a member, you will receive some additional materials on that. It's only $40 for the year, and it helps us to support economic education, discussion, and these types of events. So that is everything. Thank you so much for tuning in today, everybody. Have a great rest of your week. Mahalo.
Thank you.
See you, Rob. Thank you. See you, Phil. Thanks.
Thank you.
Thank you
Thank
all.
you all.